Deputy Tom Neville to the Minister for Health. Non-attendance at hospital appointments at University College Limerick. Deputy, 4 minutes.
Thank you, Lascaux. This is on the basis of a reply that was received in relation to waiting lists in the University Hospital Limerick. It was around non-attendees or did not attend, and some of the figures that I've been presented are quite startling. The answer came back that in 2015, outpatient department attendances, new appointments were 34,900. Did not attend of these new appointees was 5,633. And also the outpatient department attendances of review appointments was 115,649, of which 18,701 were not attending. That's a 16% of the original figure. In 2016, the new appointments were 35,536. That was an increase roughly of about 600. And also there was an increase in the do not shows again, which was up by about 400 or 500, was creeping up to 17% at 6,029. And the review appointments was 120,875 with 21,294 not attending. So you're looking at about 17.6% there. Now, that's 17.6% of the figure within that year. The do not attends may be from the year before, I understand, but we need to quantify that as the exact percentage, because if you take the cataract waiting list in University Hospital Limerick, if you were to take that 16%, you could reduce, or you could increase the number you're seeing by 130 per year to 140 per year. So, as we stand at the moment and standing still, this is a way of trying to combat the waiting list and increase efficiency. And the HSE did come back and say that the above represents the total number of new and review outpatient clinic attendances between 2015 and 16, and it also, obviously, as I said, includes the patients that do not attend. It said since the launch of the new IPMS patient administration system in 2016, we have reintroduced text reminders for patients. This is being rolled out across in a group phase. We will be assessing the benefits of the system and adding additional functionality throughout 2017. The word reintroduced text reminders has been used there. Was there other text reminders before? If so, why were they taken out? Why were they not maintained? You see in the private sector, if it's anything from your phone or utilities or even your alarm company, everything is connected to your mobile phone. So if your bill is coming from a mobile phone operator, you are told that your bill has been emailed, or you are told that your bins will be put out in 2 days' time or 3 days' time. There is reminders coming. It's a very customer-focused type interactive system, and we need more of that customer focus in the health services, particularly around waiting lists, if it allows us to alleviate and combat the challenge that we have at the moment. And that's just standing still. That's identifying efficiencies from a standing still point of view. Also, it says they will be assessing the benefits of this system. What criteria are they using to assess that benefit? And also adding additional functionality. We need to know what the additional functionality will be as well. I really do think there is, I would assume, knowledge within the system and knowledge within the HSE. There's probably a lot more than what I have in relation to technology that can be utilised here. I don't think it's the remit of me to be raising this here. This should be just fait accompli. It should be done. And it's really around why, number one, if it was taken out and why it wasn't reintroduced. And also, I'd like to see what the stats are throughout the country if we're looking at about a 17% in Limerick, and if so, that this will be rolled out as soon as possible. Thank you.
Thank you, Deputy Neville. Minister Kevin.
And I will be taking this on behalf of the Minister for Health. And I want to thank Deputy Neville for his topical issue this afternoon. On behalf of Minister Harris, I welcome the opportunity to speak on this matter today and agree with the Deputy on the need to reduce non-attendance at hospital appointments. According to the latest public HSE data, there were over 135,000 patients who did not attend new appointments, and over 343,000 patients who did not attend review appointments in 2016, in comparison to a general DNA rate of approximately 13%. The cost of the DNA is difficult to ascertain. In order to ensure that outpatient clinics and the time of clinical staff are used to the best effect, hospitals usually schedule a greater number of patients so that the clinic is fully utilised in the event that some of the patients fail to attend. There is an administrative cost associated with DNA, which is approximately €25 per person's visit. Even more significant is the loss of allocated clinical time, which could have been benefited other patients. Therefore, it is important that the HSE process initiatives to reduce the number of people not presenting for outpatient appointments. Technology has its part to play in a modern, efficient healthcare service. The Department of Health has asked the HSE to identify quick, particular solutions to resolve some of the challenges that faces our health services on a daily basis. One of these challenges is to provide digital solutions in the area of non-attendance by patients for appointment. One of the solutions eHealth Ireland has proposed is to provide a standardised national patient reminder service using SMA or emails. This solution has the potential to reduce the number of people who do not show up for appointments, and in addition, it allows current process to be adapted and new process to be built to reallocate those appointments slotted to other patients. This standardised national text reminder service project has already been initiated. Some hospitals already have a text messaging reminder services, such as the UL Hospital Group, which is integrated with their patient administrative scheme and allows a text reminder service to operate. This tailored solution will be evaluated when the project is in a further stage to determine if it is appropriate as a standard approach across the scheme. In addition, under the new outpatient reform programme, the hospital scheme will be moving to an advanced booking scheme, which will allow patients 2 choices of appointments time. This process has been shown internationally to dramatically reduce patients' failures to attend. There is also a further proposal to validate waiting lists using SMA reminder messages, which will quicken the validation process, reduce workload and increase effectiveness. A pilot is to be introduced shortly for both inpatient and outpatient services for appointment validation purposes. These initiatives are being processed in conjunction with the HSE Outpatient Waiting List Action Plan for 2017. Minister Harris will be communicating the details of these plans shortly. Before I finish, I would like to highlight that the UL Hospital Group has been identified as a good performer in the terms of scheduled care. For instance, as reported in the waiting list figures published by the NTPF in the month of March, it was the hospital group with the lowest total number of patients waiting for an outpatient appointment. And I'll address some of the other issues when I come back.
Minister, 2 minutes.
Thank you, Minister, for your reply. And obviously I welcome that the UL Hospital Group performed in relation to the good performer on scheduled care. But really we have to be seen to be more proactive in relation to this on technology. The technology is out there. The technology is there, and we always seem to be behind the 8 ball all the time when it comes to technology. If you take the private sector, we're always ahead, oftentimes, of the 8 ball. So we need to, I suppose, foster a culture within the services that we need to embrace technology and use it for its efficient purposes to help, first of all and foremost, the patient and the people who are on the waiting list. But that has a knock-on effect in actually helping the staff and the frontline staff, which I have nothing but admiration for, in which how they go about their duties and their commitment to their job. But, you know, we seem to, as I said, we seem to be behind the 8 ball all the time. And Ireland is noted for its IT in the private sector. We were the largest exporter of software 17 years ago. And still we're like, for text messages are 20 years old. And we're pushing and scraping and fighting to try and get this up and running. It should have been up and running a number of years back, as it is in the private sector. So I'm really, really pushing to have a more interactive type technology or technological system in place. Because as you said quite rightly, they've been a good performer. But there's 5,633 appointments, which was 16%. Of the 35,000 in 2016, I don't know how many of those were no-shows from 2015 that have come back into the system again. So it clogs again. So we need to get behind the figures, Minister. We need to get the intelligence and the data and the analytics, and that's what's happening in every business that survives, is analytics and data. It's driving strategy, it's driving policy, and it's driving how they make a decision. Thank you.
Final response, Minister.
Thanks, just to, I suppose, to agree entirely with what the Deputy has said, and I suppose known Tom as you do, I know he has a huge interest in ICT and technology and how it should work. I do think there is a remiss as well, though, around myself around patients themselves not keeping their appointments as well. And I do think that because so many people are on long waiting lists, that it is difficult when people don't show up, that staff are then in a position that they have vacancies. But as the Minister has replied, that in most appointments now in hospitals, they do over-speculate the number of people who are going to show up to make sure they can backfill people if they're on a list. I can agree with the Deputy on the significant number of people who don't show and people who don't show for recurrent appointments. The Minister has outlined that we are in the process of moving to advanced booking scheme, which will allow 2 patients' choices of appointment time, and I think that is a step in the right direction. Also, the initiatives are being processed in conjunction with the HSE outpatient waiting list action plan. I really think it's important that we do develop the IT systems in hospitals and right across all hospitals, not just in particular mainstream hospitals. But I do think there is a need for us now to catch up with the times, as you said. We are well noted around the world for our specialities, as you've said yourself, in the IT systems, and I do think it's time to implement that into the health service and to implement it, particularly around hospitals and appointment lists. And I will bring some of the notes I've taken, particularly about UL, I will bring them back to the Minister and ask him to reply directly to you on the specific issues that you've raised.